Everyone, I'm Jack Edser. This is Denise Stewart, who's an occupational therapist, and we'll be speaking at the Soft Tissue Injury Management Symposium. So thanks, Denise, for talking to me today.
You're welcome.
We're just going to introduce Denise. Denise has a lot of experience in treating women post-breast cancer and post-surgery. So I just wanted to talk to Denise a little bit about what she does and then a little bit about what she's going to talk about at the symposium. So Denise, your passion is shoulder rehab post-breast cancer and post-surgery?
Yes, I started treating women after lymphedema, or when they develop lymphedema, which is one of the complications that they get after breast cancer. And what I was seeing was that a lot of women had terrible shoulders. And so I started looking at why they had a bad shoulder, and what we've found is that the treatment that they undertake for their cancer actually creates lots of problems, and so they end up with scar tissue, restricted movement, and pain, and other dysfunctions.
Yeah, which impacts their everyday life and their ability to work and do a lot of the things that they would normally do, I imagine.
Well, long gone are the days when women with breast cancer were in their 70s. We're now getting an increase in younger women that I see in private practice anyway, and between 39 and 60, and so they're really still, I would be expecting, at the prime of their life, and wanting to do things, and they have usually are working, looking after children, and experiencing painful problems that often are attributed to the radiotherapy or the surgery, and often they're not really encouraged to think that there is a treatment available for them.
Yeah. So you've developed your own model of treatment that you do with these women, and you're going to speak about that at the symposium.
Yes. And so what I did, because I came from outside of the field, so I was working in chronic pain and work injuries, I just thought, well, why can't they lift their arm up? And even though they've had radiotherapy, why can't we get the skin and the scar softer? So I came from a less constrained place, and actually tried some treatment techniques, and from that found good results, and even with women years after their problem. And so from that I then was able to develop a number of treatments that are suitable for the women at different stages. And so when they just had their surgery, when they're having their chemotherapy, there's different considerations, and then after their radiotherapy, there's more work to be done.
Yep. So when the delegates are at the symposium, they'll get an idea of these models of treatment, plus a little bit of a practical demonstration or an understanding of some of those practical techniques?
Definitely. So I've developed some simple techniques to assess where the problem is, and also some ideas on, is it possible to get some good treatment outcomes from it. So it also matches up with what they're asking for in America, what the therapists are calling for, and that is to recognise that women are experiencing problems years after, and that we need people that can assess and treat those women.
Yeah. It's exciting because Denise has really thought outside the box and brought something that may have been left with women that they would have been just chucked in a box to say they can't get better, and with some fairly simple techniques and some simple frameworks has developed a really innovative, amazing treatment model. So we look forward to hearing a little bit more about that at the symposium, and look forward to meeting more amazing people like Denise.
Thank you.
Thank
See
you.
you there.